Hi, this is Angelo Mendoza of DVN3A. Today, on Neurophysiology, we will assess the cranial nerves. On cranial nerve 1, we will assess the olfactory nerve. We will evaluate the cranial nerves 2 and 3 by doing pupillary response. Cranial nerve 5, the trigeminal nerve. We will evaluate the ophthalmic branch by touching the medial canthus of the eye by our finger. Second in the trigeminal nerve is the evaluation of maxillary branch. This is done by touching the lateral canthus of the eye by our finger. Last on the trigeminal nerve is the evaluation of the mandibular branch. This is done by observing the opening and closing of the mouth if there is a resistance or none. On cranial nerve 6, we will assess the abducent nerve. Cranial nerve 7, the facial nerve. On this, we will examine the commissure of the lips. Cranial nerve 8, the vestibulocochlear nerve, or examining the cochlear nerve. This is done by examining the response of the dog from various commands.
Luna, Luna, up, 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 up.
Another on vestibulocochlear nerve is the examination of vestibular nerve. This is done by placing the dog on a normal standing position and observing whether the dog has a normal or abnormal balance. Cranial nerve 9, the glossopharyngeal nerve, and cranial nerve 10, vagus. This is done by examining the gag reflex of the dog. Cranial nerve 12, the hypoglossal nerve. This is done by observing the position of the tongue in correlation to the oral cavity. And that's it. That is how we do assessment on cranial nerves. Again, this is Angelo Mendoza for Veterinary Physiology 131. Bye!